Hello and welcome to Liquid Gold, Unlocking the Power of PRP. This is our premiere episode. Our host, Dr. Jeffrey Piccirillo, will discuss the history of platelet-rich plasma and how we have arrived at the technology we are utilizing in 2024. If you have any comments regarding the content of this podcast or any suggestions for upcoming podcasts, feel free to reach out to our host at realliquidgold@gmail.com.
Hello, everyone. This is Dr. Jeffrey Piccirillo, and welcome to the premiere edition of Liquid Gold, Unlocking the Power of PRP. Now, I'm calling this the premiere episode. We did try around 6 weeks ago to do a live version on a Thursday night around 9 p.m. Eastern Time, and the audio was bad, the internet was bad, and overall, the entire episode was bad. So I've decided to start over. We're going to record early in the week, be able to send it to an editor. We have a new studio, and we are going to put out a beautiful version early on Friday morning and have it waiting in your mailbox by lunchtime on Friday afternoon. This way you can either watch it on Friday or you have the whole weekend to catch up on the podcast and watch as many episodes as you'd like. So what is Liquid Gold Unlocking the Power of PRP? It is going to be a podcast that looks at everything PRP. Now, our audience is vastly different. When we did the first episode, I was able to look on the screen and see who all was on with us. And we had some aestheticians, we had some physicians and nurse practitioners that are doing aesthetics and sexual health. We had some orthopedic surgeons, we had some pain management doctors, all listening in to hear how PRP can be used in their practice and how they can get excellent results from the PRP they are using. We have a vast different audience every single time we do one of these episodes. So what is my history? Why am I here tonight? Why am I talking to you about PRP? You know, there are things that happen in our lives that when we look back, we realize that there was a blessing. Mine happened in the fall of 2002. I was working as an orthopedic surgeon. I was in a small town called Grinnell, Iowa, which is right in the middle of central Iowa. And I had a centrifuge rolled into my operating room. Now, at that point, PRP was very, very new. The orthopedic companies, the joint replacement companies and spine companies were starting to get into this form of regenerative medicine and roll out this technology. So they rolled a centrifuge into my operating room. It was probably 4 feet tall, on wheels, probably a couple 100 pounds. And what they told me was this. They didn't even mention the words PRP. All they told me was during my surgery, they would have anesthesia, draw some blood, and while I was performing surgery, they would run the blood through this machine, and at the end of the case, they would give me a small syringe full of a yellow liquid that they told me was high in BMP. Now, BMP is bone morphogenic protein. It is a amino acid chain, a peptide chain that helps grow new bone when mixed with bone graft. Now, that's what we were trying to solve. We were trying to get our bone graft to incorporate faster after things like spine fusions, around complex hip and knee replacements, and for hard to heal fractures. So this is where it all started for me. They asked me if I would collect data for them on my surgeries. I agreed that I would do that. And over the next year and a half to 2 years, I collected data. And what I noticed was, sure as heck, this stuff was healing our bone faster. We are getting faster unions on our spine fusions. We are getting faster incorporation of the bone graft around hip and knee replacements. And everything seemed to be working. During that 2 years of time, I was able to look into the science behind what we were doing. And that's when I realized what we were collecting is what we know now as PRP, or platelet-rich plasma. It was a way to take a blood draw, spin it, pull off the plasma, hyperconcentrate the plasma to get the platelets out, and then we could mix that in with our bone graft and get better results from our bone graft. So where did this all start? And I think it's important for everyone. I think it's important for everyone to know the history of where PRP started. It didn't start on the aesthetic side. It didn't start even on the orthopedic side. It started around 1997 or 1998 when the dentists realized that if they had what they referred to as a dry socket, if they had pulled a tooth and they had a nice clot sitting on top of the tooth, and the patient either swallowed hard, sucked through a straw, um, and dislodged that clot, now the bone was exposed and that area would start becoming painful. And the way they would get the pain to go away is they would just draw a small tube of blood, just like what we use now for a blood draw with our LabCorp or our Quest centrifuge, and they would allow that blood to clot in the tube. They'd pull the clot out with a pair of forceps, and they would set that on top of the defect with usually a little piece of Telfa. And they would tell you to be careful over the next 5 to 7 days. And that would allow that dry socket to heal in with new tissue overlying the top of the exposed bone. This was the start of PRP. So, orthopedic surgeons, there's a lot of jokes. In residency, I heard all of them. Like, how do you hide money from an orthopedic surgeon? You put it in a book, because of course we never read anything. Although, in order to get an orthopedic residency, you often had to be in the top 1 or 2% of your class. So we did read books. Orthopedic surgeons, strong as an ox and half as smart. All the jokes were running around, but the orthopedic surgeons realized that if the dentists were able to grow new bone, then we could use this to grow new bone. So we did what everyone would do. We stole the technology and idea from the dentist. And that's where orthopedic PRP started. Now, most of you do not realize that the only FDA approved use for PRP is to augment bone graft in an orthopedic surgery setting. So when we add PRP to our bone graft, that is the only FDA approved use of PRP. Everything else is considered off-label. Now, once we have an on-label use for anything, an off-label use is okay as far as the FDA is concerned. We do it all the time with medication. So it is a completely legal use of PRP, and everything we use it for now is covered by the FDA. So why do we use it? What is the whole reason behind it, and how does it work? Well, the reason it works is the platelets contain small little envelopes inside of them called alpha granules. And those alpha granules are full of small peptide chains of amino acids that are growth factors, cytokines, and signaling molecules. So when we inject it into any tissue, when we inject it into the shoulder for a rotator cuff tear, a partial rotator cuff tear, we inject it into a joint that is arthritic, we inject it into the face to help regrow collagen, such as the vampire facelift. If we microneedle it, the vampire facial, to help with texture and color, those are all uses. But what happens is when we inject it or we push it through a small bore needle, those platelets break apart, the alpha granules break apart, and they release their growth factors and cytokines. But interestingly enough, they really do nothing locally. Everything happens down a cascade reaction, which is called the paracrine cascade reaction. Now, this paracrine cascade reaction, what it is the PRP is injected, the alpha granules open, the growth factors and cytokines and signaling molecules are released, and then they bind to the local tissue. But once they bind to the local tissue, that signals on a cellular level to allow that local tissue to release its own signaling molecules. Those trigger the bone marrow to release, or what they call marginate stem cells. And those stem cells now go from the bone marrow into the peripheral circulation. And then they track back to the area of the injection, and they bind to the damaged tissue, and they cause tissue regrowth. That's how this works. So it's all tissue dependent. If we inject PRP into the breast for a vampire breast lift, it doesn't grow hair. But if we inject it into the scalp with damaged hair follicles, it does. So it's very tissue sensitive, and it depends on the damaged tissue at the site. So now you understand the basic science. So why is the basic science important? Why do we pay attention to this? Because there are things that can stop that cascade reaction. And in our practice, Regen Ocala, here in Ocala, Florida, we are really sticklers about the basic science. So we stop all anti-inflammatory medications for a period of 3 weeks before and 3 weeks after any PRP procedure we do. And that's everything from hair growth to rotator cuff partial tears to tendinitis to knee arthritis to vampire breast lifts, the O shot, the P shot. So we make sure everyone is off their anti-inflammatories, both prescription and natural. So we also stop things like the omega-3 fish oils. Those are very anti-inflammatory. Curcumin, turmeric, also anti-inflammatory, as well as all the prescription NSAIDs. So we want to make sure that that cascade reaction continues to work. The way I describe it to patients is, think about when we were kids and we would stand dominoes right next to each other, and we'd make a long chain of dominoes, and we'd hit one, and as we hit one, it would hit the next one, hit the next one, hit the next one, and it would go down that entire chain of dominoes. Well, that's kind of what the paracrine cascade reaction is. It is a chain that one reaction leads to the next reaction, leads to the next reaction. And if you're on an anti-inflammatory medication, it's like sticking your hand between two of the dominoes, and then the dominoes stop. The rest of the cascade does not progress. And because of that, the stem cells from the bone marrow are never released, and there's never there's not a good outcome. You do not get a complete regenerative outcome at the end point. So that's why it's important to pay attention to the basic science and understand that some of these little things that we do lead to a better outcome. So we will cover in upcoming episodes how we can improve our outcomes, little things that we can do to the body's physiology to make increased stem cell production in the bone marrow, increased stem cell margination, and overall better outcomes. So stay tuned for some of the upcoming episodes when we talk about outcomes. In speaking of upcoming episodes, we will try to cover all the different things that PRP is used for. I'm hoping that I can get Dr. Runnels on an upcoming webinar. He can talk about his P shot, his O shot, and some of the new things that he has coming out. I have a lot of orthopedic and pain management friends. We are starting to use PRP in the spine, actually injecting it into the disc to help reverse degenerative disc disease. And these are all the things I'd like to get covered on upcoming webinars. We are going to do a new podcast every 2 weeks. We're going to release them on Friday mornings. If you are on my email list, you will get a notification that the new podcast has come out, and you'll have a link to our hosting site. So we will be able to discuss all the new things that will be available. If you have an idea for a podcast, or you have a question that you'd like covered in an upcoming episode, feel free to reach out to me on my email. and that is Dr. Jeff at theprpcollege.com. So Dr. Jeff at theprpcollege.com. And send me your questions, send me your comments, and we'll try to add that to an upcoming episode. I'm going to close every episode with a question and answer session of any questions that came in on the previous week. So let's get back to, we talked about the basic science and how PRP works. So why do we use it? Why is PRP being used? Why are we having patients ask for it? We have patients now that come in and say, my doctor wanted to give me a cortisone or a steroid injection in my knee, but I've read that, that may not be helpful. Tell us about PRP. Or, I'm not interested in having anything fake in my face. I used to get filler, HA filler, and now I'm hearing that PRP can be converted to filler, what they're calling pure biofill, and this will cause regeneration, not to the same degree as placing the HA filler in the face, but it will still give that nice, natural, younger appearing face. So people are now asking for it, and they're asking for more natural and more regenerative ways of taking care of their body. I think they're also trying to get away from some of the big pharma and some of the pharmaceuticals. I think a lot of people are now looking at more of a wellness picture than they are of an illness picture, and they want to make their bodies well and not just mask symptoms or treat symptoms with medications. And I think that's why PRP is becoming more and more popular. Now, think of all the benefits of PRP. Sorry about that. I guess from now on, I'll learn to mute my phone before I come into the podcast. So think about all the benefits of PRP. It is long lasting. We will get anywhere from 12 to 18 months after a PRP injection of improvement in either improvement of appearance or improvement of orthopedic symptoms. There's minimal to no side effects. There's minimal to no downtime. There's no added chemicals to the body with the PRP, and it is 100% organic. It is treating the body from within, not by adding chemicals and treating it from the outside. And we have a lot of versatility, as I was saying. It can be used in joints, it can be used in aesthetics, it can be used in sexual health. So I'm glad that you came on tonight and you are able to learn about the basic science, learn why I'm here and I'm hosting this podcast. And I hope that I see you on upcoming podcasts. And I hope that I get emails asking questions and asking me to cover other topics that you may be interested in. I am always blessed beyond belief that so many people want to listen to what I say. And remember these two things over the next few weeks. Remember to always think as far outside of the box as possible, because change never comes inside of the box. We always have to think outside the box to have change. And remember, do not be passive, be regenerative. I look forward to your comments. I will put out another podcast in 2 weeks. Please email me at drjeff@theprpcollege.com, and I hope to talk to you all very soon. Have a great weekend. Thanks. Bye-bye.